A very good morning to all of you. As we are conducting sessions of foundation course along with our academic sessions. So this is also part of our foundation course. Professionalism and ethics module is important part of foundation course. So today we have two eminent speakers with us to conduct this session on principles of professionalism and ethics and attitude. And our bioethics unit of GSMC unit is the unit which conducts sessions related to bioethics and professionalism. And we have two speakers. Dr. Santosh Salagare sir is a professor of medicine, a great clinician, hypertension specialist, frontline corona warrior. Sir has set up our COVID wards under the guidance of Dr. Nadkar sir and Dr. Deshmukh sir. Sir is a great medical educationist with innovations in UG and PG curricula, a health profession education leader with significant role in MCI, MUHS and FAMER activities. Sir regularly conducts workshops on communication skills, professionalism and attitude and ethics. He is a national leader in bioethics and he has been head of bioethics unit of our GSMC unit. Our second speaker, Dr. Mariya Jiandani ma'am, she is Associate Professor of Physiotherapy. Currently she is head of GSMC MUHS UNESCO Bioethics Unit. She is FAMER Fellow and faculty and she has great contribution to undergraduate and postgraduate curriculum of physiotherapy subject. She has also contributed to this COVID treatment, patient care in terms of providing, introducing concept of physiotherapy, role of physiotherapy in recovery of these COVID patients. So I welcome our speakers and I request them to start with the session on professionalism and ethics. Okay.
So, a very good morning to all of you. And in this 1 hour, basically what we are going to go through is what we have displayed here as our session objectives for you. As you know that professionalism and bioethics forms the core, it's the foundation. So what we are going to look at is first start to understand what's the difference between profession and vocation. How do we define professionalism and what are the attributes to it? What is the role of healthcare practitioner in the 21st century? And what are the challenges that one faces? What are the core values of professionalism? What is the concept of morality, code of conduct, ethics and bioethical principles? And the relevance of bioethical principles in the practice of medical profession. So in brief, we are going to deal with this to help you understand, and there may be much more to it that you are going to contribute. It's going to be an interactive lecture. It's not going to be a monologue, or it's not that only me and sir is going to talk. We need answers from you. So to begin with, what we want to do.
You are going to see something, and you are going to see, and at the same time, some thoughts will come to your mind. See.
What are the thoughts in a word or a phrase that you can tell us? What came to your mind when you saw this?
When you saw this,
Charged up. Okay.
very good.
Anything
What else?
else? Be loud.
Looking at them, what thoughts came to your mind? What are the phrases which come to your mind about the qualities or whatever? Yeah. What did strike you the most about their what? What aspects came to your mind about them as serving the?
You saw something, right?
What was it happening? Yes? What was happening there? What first word came to your mind after seeing this? Yeah, please go on. Shout. Motivation. Okay, what else? What about you?
About AFOs, the energy
Energy. Very good. Energy. What else?
Courage and enthusiasm.
Courage and enthusiasm. Very good. Any other word? Bravery. Excellent. Very good. What else? Discipline. Very nice. Good. Any other? Any other?
Dedication.
Dedication. See, now the words are coming up. Okay, this is going to be an interactive session like this. Okay, close the books, concentrate and try to talk. try to give inputs. Okay, good. Go on, ma'am.
Was it any kind of a profession? Who were they?
Soldiers.
Soldiers. Do soldiers belong to a vocation or profession? What is the difference between the two words? Vocation, profession. Can we just use them anyhow? Is there a difference? Come on, quick answers. Whatever you feel.
Anyone has idea about what is vocation and what is profession? Or both are same? Or can they be used synonymously? Yeah, those from the convents will be able to answer. What is vocation? Anybody?
Yeah.
Your answers may be wrong, by the way. That is what profession.
Career. Career is the word he's giving.
Career,
us.
okay, career. What else? What else?
Come on, there is nothing right, wrong. Don't
On the
please
first bench.
feel shy.
On
You
the
can
first
always
bench.
say.
Quickly. On the first bench.
You are not taking your exams. Be open.
What is
It's
vocation?
vocation.
Come on.
Come on.
Excuse me.
Come on, be quick. We don't have so much time. No? Whatever you feel. What comes to your mind? What is vocation? Okay, you have a carpenter coming to your house to repair certain things. Vocation, profession. Vocation, profession, loud enough.
Good at. Okay.
Suitable and good. Two things differentiating. Anything else?
Skill. That can come from generation to generation. Carpenter का लड़का carpenter होगा, farmer का लड़का farmer होगा. Okay, good.
Okay.
Go on.
So, when you have a degree, now if that person goes ahead and takes up a degree, architecture, association, there is an association to it, lawyers, you as a healthcare provider, me as a healthcare provider. So we have certain method of study, certain institute of study. We have obtained a degree to it. We are joined with an association. We have regulating bodies. All that will come under profession. And what is a vocation? Whatever skills that may be inherited. I may do it as an earning. A carpenter may be doing it as an earning for a livelihood. But that may not necessarily culminate and be called as a profession. So profession requires training, qualification, defined roles, values and ethical standards.
So now, there were so many options after 12th standard, isn't it? Right? For our time, it was like engineering or maybe medical profession. But now for you, after your SYJC, you had so many options. So why did you choose out of all those options only this profession? What was the reason? Your answers can be in Marathi, Hindi and English. And mane Gujarati pan avde che. Okay?
I have taken inspiration from my cousin.
Okay, so there was somebody who inspired you to take. What about you? Why you took only this as a profession and not choose other one?
There was a time in my life when I actually realized that how much important doctors play in your life.
The role of doctor in the society.
so
Excellent.
that way.
Very nice. Mariya, can you take some answers from here? Or one more I will take from here.
So my interest in biology.
Your interest in
Biology.
bioethics.
Biology.
Biology. Oh, very good. I thought directly he's impressing us by saying bioethics. Okay. Yeah, Mariya, that side.
The doctors are quite inspiring, the role they play in the society.
I was clueless and my parents were doctors, so just couldn't do it. I was clueless about it, so I thought it was
Oh,
a
curiosity.
serious
Very good. It can be the possible thing.
job. Clueless.
Very good.
It was curiosity.
Yes. Yeah, because of the mask, you can sense something different words, by the way. Oh, yeah. So now, these are the reasons that for those reasons you choose to take this as your profession. So then the thing comes that Whom do you call as professional? Whom do you call as professional? You cannot call everybody as a professional, isn't it? So according to you, whom do you call as professional?
Person who is good at his work or who does his
The
work.
carpenter is good at the work, but we said just now that he is not a professional, he is a vocational. What do you feel? Who you will call it as a professional? Medical is a profession, nursing is a profession, dentistry is a profession, physiotherapist is a profession, madam's profession. Right, so whom you will call as a professional?
Someone who is qualified.
Qualified, excellent. Any other angle? Only qualification? Along with qualification, any other? Come on, shoot the answers. Degree and training, excellent. What else? Skills, very good. Attached to an institution or organization, or maybe a like body, for example, MCI, NMC. Yes, please. Certified by? Yeah, maybe. Obviously, without certification, you cannot call that person as a. So let's see that it is definitely, and you said this in the beginning answer, that discipline you saw from that video. So discipline group of individual, they possess special knowledge. They have values attached to the profession, and you said rightly, they have skills. And it is not that it has come from a generation or observing somebody in a family. Like it is by education, training and research. And that is why at MD level, research is very important, isn't it? That's why the MD is always having thesis-oriented qualification. Then comes recognized by a body. Like we are recognized by Medical Council of India, isn't it? They have Physiotherapy Council. So that is very important. Then we are prepared to use our knowledge and skills for benefit of others. That is another one. And then most important aspect is we have some ethical standards. Like profession, for example, law. Law profession has some ethical standards, isn't it? Medical profession has ethical standard. What is to be done, which is good, and what is bad. Then comes, we are accepted and respected by the public or society. Is that question mark come by mistake? Is it by mistake? The respect towards our profession currently is at stake. Currently, people are having question mark when they go to a doctor. Whether that doctor will be sending me to some other doctor. If he is sending for me investigation, what is his personal gain in that? Whether he is actually getting some perks because of sending me investigation. If you advise MRI, CT scan, the question mark comes because in last 2-3 decades something wrong has occurred in our profession where people are doubting our integrity, our ethical behavior, and that is why there is a question mark which you rightly pointed out. So when we say that, when we say whom we will call, what are the attributes, what are the qualities of a professional? I am not saying good or bad professional. A professional as such. Then the person has to be competent. Person has to have a good communication skill. In our case, it will be with whom will communicate when you become doctor? Patients, only patients. Relatives, then colleagues, then nursing staff, class 4 employees, so on and so forth, isn't it? Then ethical behavior, that's very important attribute. Then comes our duty, our responsibility towards society, and our accountability. Whatever we do, we have to be accountable for that. And that's very important in a country like India. Respecting others. So it is not like subordinates, we will behave like anything. Or nursing profession, they are subordinates, so we can just shout at them. No. It has to be respect at all levels amongst each other. Amongst our own faculty and our own colleagues. That's also very important. Then comes self-improvement and passion for excellence. Like, just the example, we both have done FEMER Fellowship from Philadelphia for advanced medical education. That we did after many years of service. You must have seen my 7 degrees. So why that? I would have just MD medicine and I would have remained as a associate professor, I would have become, because there is a minimum qualification required. But all these teachers who are there, they are excelling by learning more and more degrees. And we did so after age of 40, all these additional degree. We were only MD medicine till that time. So that is why passion for excellence. We attend conferences, we attend courses, we learn some new things. Why? It is not required actually. But we want this, what is self-improvement. What is there internationally? We want to bring in India. And that is why we did our Faber Fellowship. Isn't it? So this is where the importance lies. And then what happens? Ultimately, altruism. Whatever we will do for good for the patients. Compassion. It should not be like done for the sake of doing it. There has to be some compassion. The feeling, isn't it? Then caring, very important. Because unless we have that caring sense, we are not going to succeed. And then comes empathy. Isn't it? So, if anybody doesn't know, it is possible that this word empathy you are hearing for the first time. So who can just raise the hand and tell me what is empathy? Yes, please. Excellent. Clap for him. Clap for him. When you put yourself in somebody else's position, unless I know the suffering of a patient, I am not going to become compassionate. I am not going to respect his whatever he is saying or she is saying. Isn't it? So that is where the empathy is important. So ultimately, the entire profession is based on truth. Then what is right and what is wrong. But important is we will always give right. We will always give all our decisions toward right thing, the love, the peace, and obviously non-violence. Then you will say the surgeon is cutting the patient's abdomen. He is the most violent person. But that is for treatment of the patient, isn't it? About that also we are going to learn that what is it. So then, we know these are the qualities of our profession. At the same time, you all know, and your parents must be, just a show of hands, how many of your either or both parents are doctors? So many of you. So you know that how much they have slogged, how much, what challenge. So what are the challenges? Can you throw the answers one by one? What are the challenges to our profession currently? What are the challenges? Are there no challenges? It is smooth sailing. What are the challenges? Yes, please, loud. What is it? COVID. Oh yeah, COVID is the one of the important challenge. But that has come just now. Abhi anniversary hoga uska. So question mark in the minds of people, and we are labeled to be corrupt, unfortunately. Yeah, what else? What are the challenges? Long hours of duty. Yes, exactly. Come on. Emergencies. Yeah, we have to be available 24/7, not like abroad. 8 घंटे का ड्यूटी करो, घर पे जाओ. Exactly. Patients are losing faith in the. Yes, what is it? Can you be brief and to the point? What do you mean by that? So it is like a personal management. So many aspects to it, isn't it? Human resource management, then resources management, then whatever instruments management, everything doctors are only responsible, isn't it? Any other? Quickly. It is a health hazard. Right, very good. Yes. Changing law system. So we should be knowing what is happening is the dimensions to the law are changing. Law is there only. Baba Sahib Ambedkar has put our constitution, the laws are according to, right? Honorable Sir has done already his task. But the dimensions to the law are changing. And that's why we should be appraised of all these things. That is what is important. So then when we say that, and you rightly pointed out that both of us, and as Anjali, Madam Anjali introduced us in the morning, in the beginning, that we are currently doing this as a frontline COVID warriors, isn't it? And when we are doing it, right from day 1, 22nd of March, when the lockdown was put, before that, right from January, as the first few cases started coming, we were into it. And then it was happening not in a normal situation. It was happening in the situation of lockdown, completely different. Human resources were not reaching, the material was not reaching, the engineers were away from the duty, Class 4 employees had run away. The nurses were scared to work in the beginning. In that situation, we had to manage our professional duties. And then, somebody said just now, health hazard. Out of faculty members, 80% of our faculty, excluding me, and 19 of the residents became positive during this. And then what happens once they are positive? They are quarantined. So the manpower also of the department decreases. Then the other department helped us, isn't it? So this is where the challenges come and you rightly said that infection. What are the other infections which are spread by a healthcare provider? Other than COVID? Tuberculosis, yes, TB. Then? Bird flu, yeah, correct. Any other? Common? I can't actually get you. Okay, streptococcal pneumonias. You mean to streptococcal pneumonia. What else? Hepatitis, yeah, infective hepatitis. Okay, so you are aware of this. So you should know that how I will get protected by all these infections, and that is where, and then unfortunately the piles of dead bodies which we saw during the COVID times, this is our, one of the day of our own mortuary, and you are going to, this because now you are actually dissecting the dead bodies. Right? The fear must have little got suppressed. But myself must have seen in a short time period of time so many dead bodies. This boy is not well, just ask Mariya what is happening to him. And then comes the success stories. Very bad, huh? Attitude. Second line, 2 teachers coming all the way from other departments and you are doing this. Very bad, no? Salagare sir feels very bad about it and I am very vocal about it, by the way. Show this attitude to your parents, not here. Okay, please. Okay, so success stories. These are the success stories. 79-year-old male. These are the students of Mariya, madam. See, 85-year-old person is made to walk after his ventilatory support was removed and he went home walking. The babies were born in my ward, which never happened before. So these are the things which happened, and for us, that was the positive point of our profession. That yes, we were proud that we were part of this profession. Isn't it? So that is where we are all supposed to, and that's why, though there are challenges, we have to continue to work in the same spirit that yes, we have accepted this profession. Nobody has pushed us in the profession. Some of you may be that your father's nursing home is there. So father must have said, nothing doing, you have to take this profession. It is possible. In 200 ka, 50 ka batch, 4-5 cases must be like that. But once you accept, right? No, what I said. So, what happens is, but once you accept, you become part of that profession, and that is what is important. So, when we say, what you are going to be the healthcare providers of 21st century, when you say that, what are your roles? You have to be effective communicator, and that's why you have to learn how to become an effective communicator. Then you are to educate others. It is not that you self-education. You as a healthcare provider will educate others. That is also very important. Researcher, right? Some of you will take research in the 2nd or 3rd year of your UG life only. And then manager, you saw the example just now, and she told that I was the facility creator in charge. Why? You saw my degree, no? I am MBA in hospital management. So once I have a qualification, she managed the entire physiotherapy. Till now she is managing. We are all still in the force. But today we excused ourselves and we came here. So what is important? The management part of it. We are the managers, right? Then we are the leaders because we are leading. The doctor is supposed to lead the team. The team is of doctors, nurses, paramedical staff, support staff, everybody. Correct? Then comes team builder. We have to develop our team. Nobody was knowing how to manage COVID. But then through training sessions, we have built a team. And I'm only giving example of COVID because it is recent. But the team building is always, in an institute like KM, it is always an exercise. Socially accountable. That's very important. We have to have social accountability. We have to be futuristic. Like we cannot, okay, the COVID is over, so we'll sit back and relax. No. Today morning I went to our COVID ICU and we saw to it that all the disposables, because the number of patients are increasing in Mumbai now. So again, whether from after 10 days or 15 days, what will happen to Mumbai? We have started preparation just now only. That is where futuristic comes. Then understanding the health economics, because our country is of poor, middle class and rich. So we have to understand the health economics. What is the burden of patients on the patient's pocket? So that is also very important. Then striving for improvement. That is always, isn't it? We want to have good admin. Then we want to reflect. If I am doing this, is it correct way of doing it? Am I wrong? Can I do it better? Isn't it? So these are the things which are very important, and at the same time, we have to be safe. I'm very proud. The God has saved me just now. Till last 12 months, I was never positive for COVID, where my entire department became COVID positive. And 16 hours, 18 hours in a day, we used to work in COVID. She used to come with her team, morning, evening. But whatever happened, because we were foolproof, no shortcut to the PPE kit. We were doing it, we were training others. And luckily, I never became positive. Now though we are vaccinated. Isn't it? So that is where safety comes into picture. And who will give safety? Self. Nobody can give safety to me. I have to have safety of my own. So that is where it is important. So what is important here? Why this session? These are the 5 roles are expected out of you when you become Indian medical graduate. You must have seen this in your document of MCI. So where we are concentrating you to become a good professional. And that is why we get hurt that the front benches are empty. It hurts, no? We are not here come to interact with the front benches which are empty. We want students to be from first row. And that is why I forced you to come here. Because there has to be interaction. There has to be learning which is happening both the ways. I am also learning. She is also learning when we are taking. Anjali is sitting there, she is also learning. Isn't it? So that is where these issues come. Now what we are going to do, I want a quick volunteer. Is there any singer in the batch? We are not going to ask the person to sing. By now you must have realized, who is the singer? Come on, Tanmay. She is the singer. Very nice. Come here. Quickly, come. Singers do this task very nicely. Can you allow her? Actually, you can do it from there only. Stand there only. Okay. You can just... now, I am requesting all of you to close your eyes and listen to what she is reading out. Okay? Do this exercise. Close the eyes and concentrate on what she is talking. Okay. Singers do this job very nicely, so I have given you this time. Can we clap for her? Clap. So she gets very nice. Good. Okay. So, whenever there is comma, you will take a pause and you will read like a very nice orator. Good? Okay, go on. All of you close the eyes, please. Request. Yeah.
My mother had been lying motionless for 48 hours. It all started the evening before when I returned from work and sat down to share my customary cup of tea with her. Sushmita, my wife, called out to her to join us. Her frail frame refused to respond. She was breathing softly, but she was not moving. It was clear this was an emergency. Luckily, our doctor came rushing over and asked us to move her to a hospital immediately. It looked like she had a stroke. The next 48 hours were critical and all we could do was wait. At her advanced age, there was no question of an invasive procedure. As there was no internal bleeding, there was hope. The brain can recover magically. My mother simply lay motionless on the hospital bed